Everyone, excellent evening everyone. We are welcome to this evening's broadcast. Happy new week to every one of us. How are we? It's a new week of joy, peace and progress for every one of us. You're welcome. Excellent evening every one of us. Sorry I shifted today again to evening. Like I told us, I'm still on a trip, so I will always come up every Monday, but the time might change from time to time according to my program here in Germany. So thank God we are able to see ourselves today. Who is online with me? Excellent evening. You can greet so that I'll welcome you to this evening's broadcast. Welcome to every one of us. Excellent evening. As I share this on my group, also help me to share with friends. Wow, last week was something else. A lot of people shared it and many people were blessed. Many people were blessed. In fact, I got calls from all over the world. Let me put it that way. Italy, Sweden, Germany, USA, London, Manchester, Nigeria, every part of Nigeria, South Africa, Zimbabwe. Kudos to Aging with Grace fan. Thank you all for sharing last week. And I hope you share this week again, so that we will bless lives. Like I said, it's not just all about you, it's also helping everyone. Today we're looking at neck pain, cervical spondylosis, or cervical spondylosis or neck pain. It's what we're looking at today. We're looking at the possible causes, the risk factors, and the treatments that we can get. Hello, Chioma. You're welcome to this evening's broadcast. Let's just share it with our friends as we look at our topic for today. So just share it, so that people can be blessed. Welcome, and you can greet if you're online with me, so that I can welcome you to this morning's, this evening's broadcast. It's been a day. Thank God. We are all welcome. Share with friends as we look at today's topic, the neck pain. Cervical spondylosis, all the issues concerning it. We are going to be looking at every one of them today. So let's just share it out. I also want to be sure this is shared on my story too. Welcome to this evening's broadcast to every one of us. We are all welcome. Let's just keep sharing. Okay, Eteng Marian, you're welcome. Let me see. Joy, you're welcome. I can see Joy. I can see Eteng Marian. You're welcome to this evening's broadcast. Welcome. We are all welcome to this evening's broadcast as we share this, all around. Let's keep sharing. I want to see you share and let your friend come in and say, wow, is this person that invited me to today's broadcast today? Particularly those who are working in offices, they need to hear what we're saying today, because many of the things don't start. Any sickness that will not show you symptom as it's coming is very, very risky and bad. I always tell people it's better that you know something early than when it has already gone so far, destroying so many, parts of your body before you will begin to know what is happening. So it's usually better if you can know it on time, and then you take precautions concerning, what to do, so that you know what to do and then take precautions and be out of it, than you just be feeling you're okay yet you're not okay. So we're all welcome to this afternoon's evening broadcast. I want to quickly make sure everybody is hearing, and everybody that wants to be part of this is part of, actually part of it. So today we are looking at neck pain, cervical spondylosis, possible causes, risk factors, and treatment. Hello, Abimbola Abaje, you're welcome to this morning's broadcast. Welcome, Chinyere Okoro, you're welcome to this morning's evening broadcast. I'm just saying, but in an evening together. I was sincerely, there's someone I just need to share this with, and then we get going today. So how are you? Those of you who ordered for your products, I hope you've gotten your products. If you ordered for your products, last week. They should be arriving. For those of you outside Lagos and Abuja, they should be arriving this week from Wednesday. If you don't get your product, notify me. Those of us who are in Lagos, a number of us already have our products with us, you know, so, and that's very, very good. We need to take care of our bodies. I always tell women at this age, once you're middle age. Hello, Joyce. Joyce, you're welcome. Welcome to this evening's broadcast as we look at cervical spondylosis or neck pain. You know, most people will just say, I'm having neck pain. I'm having neck pain. That's why I put it there. But there are a lot of things that happen to us that are more than just neck pain. They are more than just neck pain, you know. And there, sometimes you will be having issues. You will keep quiet until it's becoming worse and worse. So it's now when they will say, oh, this thing has gone far. You need surgical operation. You need the other one, before some people will now know, oh, is this what was happening to me? Take care of your body. Take care of your body. Now, let me give us an example of what I'm saying. Hello, Fumi. You're welcome to this evening's broadcast. If you buy a new car, sometimes they will tell you, don't service that car, Abi. You will not need to service the car. Some cars, if it's brand new, maybe 4 years, they will just tell you, top up the oil, or they will just tell you, you know, take it for whatever, cleaning and the rest. You will just be cleaning the car. But if you have a car that is 10 years old, it's not the same way now that you will treat a car that is 10 years old, that you will treat the one that is, you know, a year old. That's the same with our body, wear and tear. So you need to take absolute care of your body when you are at your mid-age. Once you're 35 years old, you need to take care. Right, last week I was telling us something. I said, my doctor, he was a gynecologist, you know, and when I had my last child and I was now coming to hospital, those days I used to be sick, not again. He now told me, he said, do you know that you've had a lot of depletion? When you are menstruating, you're depleting calcium and some other, you know, vitamins and nutrients that you need. When you're any pregnancy, you're going through a lot of hormonal changes. And he now said, very soon, that was then a long time ago, you will soon begin to talk about menopause. I'm already talking about it now. So he said, go and get calcium. You know, he was so nice. He was one of my husband's friends. He will call me and say, have you gotten your calcium? I hope you have started taking your calcium. Hello, Ebele. You're welcome. Welcome, Ruth, to this evening's broadcast. So, we are like cars that have been used. You've had, like, some of us, we've had 7, 8, 4, or 2 children. So, imagine going through pregnancy 10 times, 8 times, 7 times, 2 times. You know, a lot has gone in. So, we need to take care of ourselves. Even if you're a man, it's the same thing. So, today, we're looking at cervical spondylosis. Cervical pain is very common in adults these days. You know, it is caused due to osteoarthritis or cervical spondylosis. We treated osteoarthritis last week and rheumatoid arthritis. You can watch the video and watch through all that we discussed, you know. So in this condition, the structure of bones, joints, and disc connected to the neck and the overall posture of the body, you know, these are what you need to take care of. So cervical pain is majorly caused due to wear and tear of the bones and the cartilage in adults. That's the main cause of it. Hello, Lisa Cynthia, you're welcome to this evening's broadcast. And that's what I'm saying. When the way you handle an old car is not the way you handle a new car. So as you are aging, you must take care of your body. You need to support and supplement your diet and the rest, you know, to be able to have the best, to perform in your optimal level. You need to do that. Hello, Ma Ewooks, watching from US. Thank you for joining us. You know, so this pain is majorly due to wear and tear of the bone and the cartilage in adults. Then the severity of the cervical pain depends on various factors and treatments, and you know, all these things vary depending on your nature of work and what you do. But you know, some treatments, usually they can be handled with treatments and exercises, some kind of treatment. Hello, Mowumi. Welcome for me, Bo. A lot of us are joining in. I'm still going to welcome every one of us to read through. So if I'm not welcoming you now, know that I'll welcome you later. Because some people will drop. You are not welcoming me, you're welcoming others. I don't want to be cutting short too many times. So I'll still welcome every one of us. So, you know, exercise and some kind of diet treatment, lifestyle change are an integral part, you know, in treating cervical pain. And one can also improve your diet to nourish your body and supply all the necessary nutrients that can alleviate pain for you. Hello, you're welcome. Welcome, Favor Endurance. This is your first time of watching. We can also say welcome to those new people who are dropping in that they are the first time. You can just drop in welcome. And please, as you're joining in, share with others. Let people hear this thing. We need to set people free. One thing we should know is that prevention is better, is safer, is cheaper than cure. I'm telling you. Not even the trauma you go through when you're not feeling fine. It's that alone. What can pay for it? Health is wealth. Health is beauty. I'm telling you. Just go and be sick for 1 week. I tell you, you will wonder. You will ask yourself, what could I have done to have been healthy? That's why I want us to share this thing, so we can share knowledge with ourselves and actually be free, you know, from some of these things. So what is actually neck pain? You know, your neck is made up of vertebrae that extend from the skull, all the way from your skull inside, you know, to the upper torso. And the cervical disc absorb shock between the bones. The bones, the ligament, and the muscles of your neck support your head. And that's what allows motion. You can turn your head from one place to the other. So any abnormality, any inflammation, any injury can cause neck pain. And also stiffness on, you know, right in the neck. So many people experience neck pain or stiffness of the neck occasionally, but in many cases it's due to poor posture or overuse of your neck. Some people don't know how to sit well. If you go down my page, there was a time I handled posture, how to sit, you know, in one of the Saturday exercises that I was talking. And that's why I talk a lot about fitness ball. If you look behind me, you will see my fitness ball right there, the purple fitness ball. It's very, very essential for people who are working in offices. Why? Because when you're sitting on your fitness ball, it helps you to maintain a good posture. So, and it also helps your muscles not to be relaxed. It makes your muscles to be active. So don't sit on a static chair for too long. Some people work in the office and they have to sit for 4 hours at a stretch. It's very, very bad. It will give you poor posture, and that's what will begin to cause some of these pains and stiffness of the neck and some of your other joints and the rest. Please buy fitness ball anyhow you can. If you're working in an office and you have to stay for long in the office, buy fitness ball. This is my fitness ball. I came all the way from Nigeria to Germany with it. Anywhere I go with it. If I know I'm going to sit for long, and okay, I forgot to also bring my neck, my pillow that I use on my neck. If anywhere I go and I know I'm sitting in an uncomfortable, I don't look at what people are looking though, because they won't be there when I'm having the pains. So all this cosmetic and trying to belong. If I'm going in my office, they all know me. I carry my ball in my car. I carry it, and when I come down, when you know they will be running, oh, mommy, give us a cardio, go and keep for me. Because when I sit on the chair for 1 hour, I get up, walk around. Sometimes when I need to take a phone call, I make sure I get up. I don't sit down so that I don't sit for too long. And then I will move away my executive chair and sit on my fitness ball, because that's my health, so that I can make sure that my muscles are moving. Hello, Vivian Okereke. It's your first time. You're welcome. Let's welcome Vivian. Everybody welcome Vivian. So I sit so that my muscles, my core muscles will be active. And then it gives you a good posture. It's because I'm talking about what causes neck pain. And I'm saying that bad posture is one of it. You know, so also sometimes neck pain and cervical spondylosis come because of injury from a fall. Or some people who are doing sports, they can also have that injury. So always be sure, if you fall, don't take it for granted that, oh, it's not paining me, I'm okay. You must go check it out and see what is happening to you. Then most of the time, neck pain isn't a very serious condition and can actually be relieved in a few days when you're having it. So if you're having neck pain, watch it, do some of the exercises I'm going to teach you today and some of the things I'm going to teach you today. If you stay till the end, we're going to look at some home remedies that you can use. Then if it's just for a few days, no problem. But in some cases, neck pain can indicate serious injury or illness that requires a doctor's care. And that's why you need to watch it to know how long you're having it and know what to do. And if you have neck pain that continues for more than 1 week, and I mean more than 1 week, or that is very severe, or is accompanied by other symptoms, then you need to seek medical attention very, very fast. The earlier, the better for most of these things. So I want to briefly just look at the difference between arthritis and spondylosis so that we can understand, especially for those of us who have been to doctors and they've written such things for us. Now, spondylosis describes the general degeneration of the spine that can occur in your joints, in your disc, in your bones, you know, the bones of your spine as you're aging. But arthritis, like I told us last week, is an umbrella term for more than 100 conditions that cause painful joints. And remember, I said joints all over. You have joints all over, all the way from your fingertips, all the way through your neck, through your body, you know, all over we have joints. So arthritis is just that umbrella terms for more than 100 conditions that can cause painful joints. And in the case of spondylosis, the spine is full of joints that can be affected. So that's the difference. So sometimes, you know, they say that cervical spondylosis is a kind of arthritis, you know. So, and then what is the most serious complication of spondylosis? You know, the main complication of spondylosis is your low back, at your lower back, your mid back, and then the neck. It starts, you know, it can either be your neck, your mid back, or your lower back. Usually the back and the neck pain caused by spondylosis is not that serious, but some people develop chronic pain due to that condition. So, and that's why it's now not good. Now, it's not like it's bad on its own. But when you are having your cervical spondylosis, either your cervical spondylosis or maybe your neck or your back pain and the rest, and the pain is very severe. Like I told us last week, if you're having severe pain, it can make your blood pressure to rise. If you're having severe pain, it can make you to be depressed. It can make you not to eat well, and then ulcer will come. It can make you to eat wrongly, and then diabetes will come. It can make your blood pressure to go high. Depression will come. Lack of sleep will come, and so many other complications will now begin to come. So that's why it's good to handle it and prevent it if possible. And if you're already having it, to make sure that you handle it on time. It is unusual, you know, for spondylosis to cause any serious neurological dysfunction due to nerve compression, but it's just the aftermath that people now look at and wonder why. So what are the causes of cervical spondylosis? You know, most cases of cervical spondylosis, they are caused by natural wear and tear on the cervical spine and supporting tissues that occur with age, like I told us. And that's why we need to take care of our bodies as we are aging. Take care of your body, add some supplements to supplement the foods that you're eating to make sure you're well. So by age 40, the disc and the entire spine, including the cervical spine, often begin to dry out. They don't receive fluid as they should, you know. And so this comprises, you know, compromises their ability to cushion your vertebra properly. So ligaments in the neck also stiffen with older age. So this is some of the things that will make you to have, you know, cervical spondylosis. Age, because of the fluid that is not being taken, you know, to your spine and to all the ligaments, you know, when you lack this to cushion the vertebra properly, then the ligaments of the neck begin to stiffen, and this is actually caused by old age. It's not that there's anything. So, and that's why, like I said, you need to support to make sure that your body actually gets what it gets. Then in addition, people today often hold their necks in uncomfortable, unnatural positions for long periods of time. When they stare at their smartphone, when they stare at their computers, when they are in several electronic devices, they just, you know, keep their necks in a very unnatural, remember what I said, unnatural and uncomfortable positions. For example, let me tell you, it's wrong for you to hold your phone like this. Can you see me? What's happening? Pressure on my neck as I'm looking down. Can you see? And then sometimes you don't look at it. You take a book to read and you're already putting down your neck. Or you're on the bed, and as you're on the bed, you're leaning on one hand and you're putting down your neck. No. If you're doing it, if you do it once in a year, no problem. But some of us, we do it every day, every moment. It has become part of us. And because it doesn't come with pain initially, you won't know. But you're causing a lot of damage to your cervical, you know, your neck and the rest. So you need to look at what you do. Now, they always tell us, hold your phone so that you will look straight. Can you see how I'm holding my phone? So that I'm not bending, I'm not tilting anyhow, but I'm looking straight on the phone so that my neck will be in a natural and a comfortable position. And that's why I always tell people, part of the things you need to do, because you're welcome to this evening broadcast, you need to stand up when you want to answer your phone. Take a comfortable position. And you know, this bad habit leads to more wear and tear placed on the neck and the vertebra at a much younger age. These things, we start it because we're not feeling it, we don't know about it. So it will now start at that younger age, and then it will now lead to the development of this condition when we are older. And even for some younger adults, you will see some young children who are in school, who are reading, they're already talking about, my neck is paining me, this one is happening to me because of wrong positioning. Also, neck pain or stiffness can happen for other reasons. Another reason is muscle tension and strain. You know, this is usually due to activities and behaviors, like I said before, poor posture, working at a desk for a long time without changing position. You need to change your positions, like I told us. Don't sit in one place for too long. Please, I'm begging you. Those of us who are working in the office, don't put a timer. You know, some of us, we have what we call, we put on our laptops to, and it will make a noise so that we will move our eyes away from the laptop. Do the same for when you're sitting. Do the same for when you're sitting. Make sure you have a timer that tells you change your position or things like that you can do. What I usually do is to do my timetable in a way that I do things that, because I look at timetable, I'm a timetable person. So that can help me. And also my alarm, I set my alarm to also allow me to do that. I'm going to answer questions later, and I'm going to look at us and greet us and I'll answer all our questions. I'll try to be faster so I can go through our questions. So like I said, poor posture, then sleeping with your neck in a bad position is also one thing that can cause it, and jerking your neck during exercises. That's why you should be careful of the kind of exercise you're doing. I can't forget one experience I had. You know, I saw some people doing exercise when I wanted to actually lose weight desperately. I saw some young men, these are young men or athletes, and I watched their video. I started doing it with them. My mountain climbing, you know, all this was until I sprained my ankle. That's when I knew myself that my age is not their age. So you need to be careful of the kind of exercises you're doing. Then another thing that can cause some cervical spondylosis or your neck pain is injury. The neck is particularly vulnerable. I'm sure we know. It's very, very vulnerable to injury, especially in falls, car accidents, sports, you know, where the muscle and ligaments of the neck are forced to move outside of their normal range. So if the neck bone, that's the cervical vertebra, are fractured, the spinal cord may also be damaged. Neck injury due to sudden jerk, you know, in the car, you know, is also common. And sometimes it will jerk like that, you won't know. So you need to be careful the kind of cars you sit and how you sit in the car. Then another thing that can actually cause neck pain is heart attack. Neck pain can usually, you know, be a symptom of a heart attack, but it often presents with other symptoms of the heart, you know, such as shortness of breath, sweating, nausea, vomiting, arms or jaw pain. So also, when you're having neck pain, you need to actually, like I said, if it has stayed for some time, you need to visit the hospital so they can do a thorough check on your heart and be sure that it's not due to heart issues that you're having that neck pain. So if your pain hurts and you have other symptoms of heart, you know, related things, quickly run to the hospital and call the ambulance. If you have that kind of pain and you are alone and you can access the ambulance, please call the ambulance very well. Thank you, Vivian Okereke, for thanking me. God bless you. So another thing that can cause neck pain is meningitis. Meningitis is an inflammation of the thin tissue that surrounds the brain and the spinal cord. So in people who have meningitis, a fever and headache often occurs with a stiff neck. So meningitis can be fatal and is a medical emergency. So if you have that symptoms of meningitis, seek help immediately. Seek help immediately so that you can be helped well. Sorry, give me 1 second. I forgot to put off my dishwasher. I need to put it off and come back. And I was one though. I was one to put on this dishwasher. Anyway, so I stopped at meningitis. Meningitis is an emergency. So if you're having that kind of pain, stiff neck, fever, headache, please run to the hospital. Another thing that can cause neck pain is rheumatoid arthritis, because it causes pain, swelling of the joints and bone spurs. So when this occur in your neck area, there will be neck pain. So you need to also be careful and know. Then osteoporosis weakens bones and can lead to small fractures. This condition often happens in your hand and your knees, but sometimes, like I said last week, it can also happen on your neck. Then we also have the fibromyalgia. It's also a condition that causes muscle pain throughout the body, especially in the neck and shoulder area. So these are some of the things that can cause pain, but most especially, like I said before, as you age, the cervical disc can degenerate, and this is often known as spondylosis or osteoarthritis of the neck. So this can narrow the space between the vertebra, and it also adds stress to your joints. So when a disc protrudes, as you know, from a trauma or injury, it may also add pressure to your spinal cord or your nerve roots, and this is also called the herniated cervical disc, also known as ruptured or slip disc, that people can have. So there is also the spinal stenosis, you know, which occurs at the spiral column, as your spiral column narrows, and it will cause pressure on the spinal cord or also the nerve roots, you know, as it exists in the vertebra. So this can also be due to long-term inflammation, which are caused by arthritis or other conditions that we have mentioned. All right, so I've told us all the causes, but in rare cases, neck stiffness, neck pain can also be because of congenital abnormalities. It can also be because of infections. It can be because of tumors, and it can also be because of cancer of the spine. But those are in rare cases. Like I said, usually if it's short period, you can just have some remedies, but if it's elongates, then you need to rush to the hospital, but you can prevent. And I always say prevention is better, safer than cure. All right, so let's briefly look at a few symptoms, just a few symptoms. And like I said, it doesn't appear initially when you're already going through that stress and causing all those, you know, your neck and your joints to go through it. You won't feel all this. It's when it has already become developed that you begin to feel some of these symptoms. So many people actually experience no symptoms when they are having cervical spondylosis in its early stage. But as it progresses, like I said, it typically leads to neck pain. It will now lead to stiffness of the neck, and sometimes the people will have one kind headache that even when they are relaxed, when they are rested, they are having that headache. Then occasionally, this condition can also affect the spinal cord and your spinal nerves. So, and then it will now begin to cause dizziness. The people will be feeling dizzy from time to time. It can cause numbness and tingling on your externalities, all the extremities of your body. Like it can go from the neck all the way, it will go round all the way to your hand. You'll be feeling numbness, you'll be feeling one kind of tingling, and then even sometimes it can actually cause incontinence. You will just be having frequent urination. You know, this is all cervical spondylosis can also cause this. Then cervical spondylosis pain and stiffness often worsen in winter, Harmattan, cold weathers, you know, and because it stiffens your neck muscle and your neck ligaments cold. So you need to be careful. And that's why I know that when people are getting old, one of the things we normally buy for them is warm sweaters so that they can keep warm. So you yourself try and keep warm in cold season. Don't take it for granted. Because, you know, my husband always says that it's better for you to have heat than for you to have cold. Because cold is not easy to manage, but heat, at least you can manage having heat. So now, let's look at how do we treat neck pain. Early treatment after you first suspect you have developed this condition can not only help neck pain and stiffness, but also slow disease progression. And that's why I always say start early for anything. Even for those of us who are already 40, 45, getting to 50, prepare for your menopause season. A woman called me, and by the time she gave me the history of her life, she was like regretting. This was just this week. She said, I wish I heard you earlier. I would have started some of these supplements that can help me to pass through menopause well. Because she's already in her post-menopause, but because she didn't take care of that period well, of 7 to 14 years of having lower reduced estrogen, very erratic progesterone, hormonal level, you know, it actually destroyed a lot. So she's now up with high blood pressure, diabetes. In fact, when she was talking to me, I said, okay, don't worry. We will handle these things one by one. God will help you and make sure you're healthy. Start on time. Don't take things for granted. A lot of us, we will go to the market, buy clothes that when you look at the amount, you wonder. But then they now tell you, buy supplements that can help the body, that we wear that clothes and wear that shoe and carry that, oh yeah, give me names. Give me names of designers. Oh yeah, drop it now. Help me. I always tell people, help me with designers. You will see some people buy one bag, 500 pounds. You tell them, now buy supplements that you can use, 100 pounds. They will be looking at it and counting what do they call it, pence and the rest. Now, you're buying a lot of clothes, and the body that we wear it is suffering. We need to be very, very careful. So early treatment, prevention, supporting yourself at this age is very, very important. So diagnosis typically requires a physical examination, an X-ray or CT scan. If somebody is already having serious neck pain, go early so that the hospital will be able to, because when you go, you wait, your pain has gone for 3-4 weeks before going. They will start from where you enter, you know, to look at what to do. So treatment from neck pain will depend on the diagnosis that the doctors get. And in addition to a thorough history and physical examination by your doctor, you may also need one or more of the following imaging studies and tests to help your doctor determine the cause of your neck pain. They will do blood tests, X-ray, CT scans, MRI scans, electromyography, and this will allow your doctor to check your health generally and your muscles to find out. Like I said, there are other complications that can come, so you need to be sure. And sometimes they can also do the spinal tap, the lumbar puncture for you. Also, depending on the results your doctor will now get, they may now refer you to a specialist for treatment of the neck, which can include eyes and heat therapy. They can tell you to have your eyes and heat therapy. And that's why sometimes it's not good for you to just go ahead and do one. They can tell you, okay, you do the ice therapy at certain time and combine it with heat therapy, then exercising, stretching, and physical therapy, pain medications. They can also give you corticosteroid injections, muscle relaxants, neck collar for some people, traction, antibiotic if you have an infection, then hospital treatment if a condition such as meningitis or heart attack is also part of it. And then sometimes some people have to go through surgery. Now, also, if one is treating cervical spondylosis, they can have neck exercises. Neck exercises offer natural relief of the neck and stiffness associated with cervical spondylosis. And these exercises help to loosen tight ligaments and stiff neck, and they also help to build strength in the muscles to support your cervical spine. So neck exercises can not only help alleviate pain, but they can also halt the progression of the disorder. And then when muscles that help support your cervical spine are stronger, they actually help maintain proper posture, so, and then it will keep you from placing more stress on your cervical spine that is necessary. So we are going to be looking at some of these exercises on Saturday. Remember, Saturday is our exercise, 9 a.m. So this Saturday, we are going to be looking at details of the exercises that we can do. I'll try to show us some practical ones. So join me on Saturday so that we can do the exercises. Then the next thing that you can use is neck adjustment, also called neck manipulation. Neck adjustment performed by a chiropractor. You need to go to the people who do it, and then they can relieve. It can actually help relieve your spondylosis. Then massage can also help. You also visit the experts, and they also help to do it. Now, like I said, prevention is better than cure. Prevention is better than cure. So make sure you have enough supplements to make sure that your bones are receiving what they need to receive, that your joints are lubricated, and that you're eating good diet. I'm going to run through the diet today, but we'll have a day that we can do 1 or 2 recipes. On Mondays we normally do some cooking, so let me just settle. Maybe when I'm back in Nigeria, or the day I'm really settled in Germany, I'll be able to show you some recipes of food that can also help you. But let's look at a few things you can do at home if you're having neck pain. So if you have minor neck pain or stiffness, take these steps that I'm going to take. Remember what I said. If it's very severe and serious, visit the doctors. Let them find out what is wrong. If you want to prevent it, take your supplements and your good diet and a good lifestyle. I showed us some supplements that can help you, like calcium, like Nature Min, that can help with your calcium, with your vitamin D and the rest that you need for better health. Then, but if you're having neck pain and you need like a first aid to get out of it, apply ice for the first few days. After that, then you now start applying heat with a heating pad. That is hot compress, or by taking a hot shower. Then you can also take some kind of pain reliefs like ibuprofen or acetaminophen. You can also take supplements that can help relieve pains, like I told us last week, like Active HA or Forever Move. This can also help you, or Forever Freedom. They can also help you. And usually I prefer supplements because they are made from natural raw materials and they hardly have any side effects, like pure medicine would have side effects. Then you also need to take a few time off some of the activities that cause such neck pains for you. Take a few times off those activities, and like I said, you need to have noted what caused it so that you can stay off those. If it's sports, stay off sports. If it's sitting in your office chair, stay off that office chair for some few days so that you can have your neck well back before you resume your activities again, before you resume your natural activities again. Then exercise your neck every day. There are some neck exercises which we are going to also be doing on Saturday. I hope I will have enough time to do all this. Okay, then do slow stretch. You stretch your neck in side to side and up and down motion. Slowly, please, not too fast in a way that you're going to hurt your neck. So do all those slow motion exercises, side to side. You can see what I'm doing, and then up and down. We're going to be doing this on Saturday fully. Then use good posture. Please, good posture. Like I said, if you're sitting for a long time, get your exercise ball so that you can have better posture. Avoid cradling your phone between your neck and your shoulder. You see us, I do it too, but avoid it. You see what I'm doing here? Some of us, that's how we hold our phone, because we want to be doing 5 things at the same time. Very bad. I'm talking to myself now. Very, very bad. You hold your phone and then you're doing this, especially when you're in the office. Can you see what is this natural? Please, can somebody answer me? This is not natural. I'm already giving strain on some parts of my neck. You might not feel the pain then, but when it's continuous, when it's consistent, you're already harming something in your neck. All right, so then change your position often. Don't stay in one position for a long time. Don't stand or sit in one position for a long time. Get a gentle neck massage from time to time. When you have what, just, you can do it yourself. Just massage your neck. Feel good, massage your neck. Then you can also use a kind of special pillow for sleeping. There are very good pillows they have now. Not all this stiff one that will keep your neck. Don't use a neck brace or collar without your doctor's approval. Some people will just go get neck collar and begin to use it by themselves. It's not good. All right, so let's quickly look at some diets that can help relieve cervical pain. Nature, as we know, has bestowed us with a lot of nutritious food items that can also help us and make our bones healthy and keep them in good shape. God is wonderful. All over the world, no matter where you are, food heals. If you eat the correct food, if you eat the correct quantity, if you eat it, cook it the good way, food heals. But the problem now, of course, I don't need to go through it for us again. Where are they planting it? What kind of soil? Have you not used fire to burn all of them? And that's why I'm an advocate for smoothies, because smoothies will help you to take your food natural. So choose the right food for bone health. It's very, very essential. In fact, connective tissue and nerves can help to reduce pain and inflammation, because inflammation is one of the major issues that causes all this pain in our bodies, even throughout our bodies. So proper nutrition is very essential for maintaining skeletal health. As far as the skeleton is, nutrition is important for it. So if one has cervical pain, then you should keep a good check of your food habits. Check your food habit. Also, consuming a diet which is rich in anti-inflammatory foods promote the health of your bones and your muscles drastically, and usually we reduce muscle pains also. So I'm going to run down some of those foods and minerals that you need to increase. Number 1 is water. 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 However you want to pronounce it, though. Very, very essential. Keeping your body hydrated is the key to keep it healthy all time. What quantity of water do you take? I always recommend water therapy as you wake up. And then you take enough water, up to like 5 to 8 liters if you can, depending on your body mass. It's not good to take too over much of anything also with water, or else it will reduce your electrolytes. So if your body does not have enough hydration, then it can lead to muscle pain. And when the body is hydrated, it hampers, when your body is dehydrated, it hampers the normal muscle and nerve functions. So please don't miss out on water. Make sure you take your water always. Then magnesium. Recently, magnesium has been promoted by doctors for better bone and skeletal health. Deficiency of magnesium in the body can lead to neck pain, muscle soreness, and muscle tension. So magnesium is one essential minerals which help in relaxation and contraction of muscles. So magnesium is often found in abundance in soybeans, nuts, whole grains, fruits, and vegetables, especially dark leafy vegetables. An adult male should optimally consume 400 milligrams of magnesium daily, whereas a female can go for 320 milligrams. Now, I told us about one supplement last week, which is Nature Min. Nature Min has enough magnesium, enough calcium, and some of the nutrients I'm going to be telling us today. So it's one essential supplement for any woman that is 35 and above. Nature Min is very, very important for you, and it's very affordable. Very, very affordable. Now, also you need antioxidants and fibers. Antioxidants, because they have anti-inflammatory properties. Most antioxidants like aloe vera gel, most antioxidants like also lycium, if you can get lycium roots, if not, you take it in supplement. They are antioxidants. A-beta care is another supplement that is power-packed with an anti-inflammatory properties. These properties help in reducing inflammation in your body. So eating anti-inflammatory food can also help in relieving you pain and reducing internal inflammation of muscles and nerves. And it also will help to calm your nerves and give you ample strength in your body. Another food you need is calcium and vitamin D. Of course, you can get vitamin D from early morning sun. Keeping your bones healthy is a vital step towards having a good cervical, life. So consuming foods that are rich in calcium, vitamin D will help your bones to be strong. Calcium also helps to increase your bone strength, and then consuming vitamin D will now help you to absorb calcium in your body. And that's why they talk about early morning sun. If you take all the calcium and you don't have vitamin D, then it won't work. And that's why it's also very essential for you to know the supplements you're taking. Don't just go and take only calcium and then you're not having vitamin D. And that's why I advocate for Nature Min also. Nature Min combines magnesium, vitamin D, your calcium, your vitamin D, your magnesium in the right quantity and enough quantity per day for everyone to take. Recommendation doses is about 1,000 to 1,500 milligrams of vitamin D every day that you're supposed to take. Then omega-3 fatty acid is another anti-inflammatory food that you should take. They are found in abundance in fish, salmon fish. Since I came to Germany, I've been taking a lot of salmon fish. They are not so common in Nigeria, even though I found a place where I can buy them very easily when I go back. Because you're supposed to take up to like 3 to 5 portions of salmon fish or your mackerel or your sardines to get omega-3 fish oil. So consuming omega-3 fish acid will help to lower your level of inflammation and the level of the inflammatory chemicals in your system. So if you don't like eating fish a lot, then alternate it with fatty acid supplement like our Active C. Superb. I just don't have time. I'm almost running out of time. I would have done an experiment with our Active C. A lot of people tell me, I take omega-3 fish oil. I take omega-3. I said, if you take mine, you will know that that's the correct one. I've done an experiment for people with it. Put mine in the freezer. It's not blocking because that's the real fish oil, and that's how it will help to melt away every inflammation and melt away some of those cloggings you're having in your arteries and your system. So if you don't like eating fish, and you might not even be able to take enough, and that's why I advocate also Active C omega-3 fatty acid. You can also take flaxseed, green dark leafy vegetable, walnuts. All these contain omega-3 fatty acid, and they can help to improve your bone health and help to improve your cervical health. Then diets that you should avoid. Well, I've told you what you should increase: omega-3 fatty acid, magnesium, calcium, vitamin D, any anti-inflammatory foods, increase them. Then reduce your intake of high inflammatory food and substances, because they can drastically increase the pain that you're having. So reduce saturated fats. Very, very bad. They are not good for us. They are the major cause of inflammation in our body. Saturated fats. Please reduce it. Go down my page. You will see where you can just type types of oil or good oil on my page. And if you have not liked my page, please like my page, follow me, especially like my page, so that you'll be able to get to know when I go online, when I go live. And please help share this with many other people so they can learn. So I treated on my page, I treated grades of oil, the best oil, the better oil, and the worst oil. So go and watch that video. It's very, very essential. I even tried to show us how to make avocado oil and some of the oils in that video. So go and watch that video. So you need to consume non-saturated oil. And I've told us omega-3 fatty oil. Olive oil, very, very, very good. It's just that olive oil will not be able to stand high tension. Go and watch the video. You will get a lot from it. Now, consumption of high-fat dairy products too can lead to inflammation. So you should avoid high-fat dairy products, okay? Then also, it will also make your bones to be weak and brittle if you consume alcohol or you smoke. So alcohol can lead to loss of magnesium. Alcohol can lead to loss of calcium from the body in the form of urine. And smoking can lead to bone damage. So we also need to be very, very careful of that. Then also, now I want to finally tell you, if you're, like I said it before, I want to emphasize it, and then I go and answer our questions very fast, because I just have like 8 minutes to 1 hour to be over. I don't like overshooting 1 hour. When do you see your doctor? Let's just look at that. If symptoms persist for more than 1 week, please consult your doctor. I'm not a medical doctor. I always tell us I'm an alternative nutritionist. I teach you how you stay healthy and you stay away from hospital with the food and a change of lifestyle. So if you're having that severe pain and it has stayed for 1 week and you have tried all the things I've told you to do, quickly rush to a doctor. Or if you're having severe pain with without having any cause for it, quickly go and see a doctor. If you see a lump on your neck, I'm sure we women, we know how to observe, and even men, you need to check your body very well so that you don't have lumps. And when you see something on a side of your body and it's not on the other side of your body, you need to be careful about it. Please, like I always tell us, take care of your body, listen to your body, note about your body. If you're having neck pain and you're having severe fever, go to the hospital. If you're having neck pain and you're having severe headache, go to the hospital. If you're having neck pain and you have swollen glands, please go to the hospital. If you're having neck pain and you're having nausea or you're vomiting, please go to the hospital. If you're having neck pain and you're having trouble swallowing or breathing, please go to the hospital. If you're having neck pain and you're having severe weakness, please go to the hospital. Or you're having numbness, tingling, pain that radiates down your arms and your neck, go to the hospital. Why am I saying go to the hospital? So that you can clear some of the major issues of heart attack and major sicknesses. If they now say you're okay, then come back. Let me give you the supplements that can help you to be well. Supplements that can help you to stay away from those pains. Supplements and food recipes and menus that can help you. If you're having pains and you have inability to move your arms or your hands, you can have one kind of neck pain and you can't move your hands or your arms, you need to see the hospital. If you're having neck pain and you have inability to touch your chin or your chest, please go see the doctor. If you're having neck pain and your bladder or your bowel is dysfunctioning, please go to see the doctor. And if you have been an accident patient and you fall and your neck hurts, you need to see your doctor very fast. If you have seen them and they say you don't have any serious medical issue, but you're still having those pains, see me, and then I'll tell you some of the supplements you can use. Or you can also take the course of prevention, which is better than cure. So I want to check our questions now, and then we call it a day. Just permit me to check our questions now, and then we'll call it a day. I have a lot of comments. I'll try to make sure I go through them. I'll try and make sure I go through them. Oh yeah, comments come up. Okay, somebody is asking, what are foods rich in magnesium? She's asking us what foods are rich in magnesium. Can somebody, that's why I always like people to help me to type in when I'm talking, because I always mention that. I already told us beans, nuts, you know, I already told us whole grain, green leafy vegetables. So those are it. Somebody said this is my first time. I hope I'll be able to see all the questions. I'm not even seeing. Let me see how I can see all the questions. How do I? All right, okay. Somebody said, what about central multivitamins, ma? I don't know about it. I know about the ones I've told you. So you can ask the people who recommended that to you. I've told you the supplements I know that have worked for many people. But somebody said, I'm new. Yes, you can send me a message on my WhatsApp. Please, my WhatsApp number is already on the screen. My WhatsApp number is already on the screen. Let me see if I can get this and pin it down. Okay, it's already pinned. My WhatsApp number is pinned by one of my staff in Nigeria. So it's pinned there for you already. So thank you, Shegu. Shegu, thank you for all the comments and joining. All right, so you can call me, WhatsApp me anytime. I will always answer. Okay. Oh, thank you, Queenie, for thanking me. Good evening, Sabitio. Thank you, Alice, for appreciating. Talutu Yusuf said I'm always smiling. Thank you, Talutu. You know one thing I believe in, if it doesn't make you smile, change it. Make sure it does what? Make you smile. If it doesn't make you smile, please change it. Talutu, that's why I smile. Anything that goes to give me, I change it. All right. Chinyere said, my sister is suffering from all this. We are watching it with her. Thank you so much. Thank you for appreciating. Oh, Ewokse from US. Thank you. Yes. Always tell your friends. Favor. Oh, it's your first time, Chinyere Okoro. Thank you for joining us. You're welcome. Good evening, Funke. I'm looking for your questions. Your first time, Joyce. You're welcome. Your first time, Favor. You're welcome. Good evening. Lorenzo Solomon is saying, can I have my Germany number? Please call me on WhatsApp. Incidentally, I've not even activated my Germany number. The SIM is there because WhatsApp is working, so I didn't activate it. So call me on WhatsApp. You have my WhatsApp number. Call me on WhatsApp so we can talk on WhatsApp. All right. Okay. I usually have pain on my neck, and please visit the hospital. Okay, Vivian. Visit the hospital, please. Let them determine what it is, and then you can now talk to me after. I have a lot of people who already called me last week or sent messages to me last week telling me what the doctor said. Some of them even sent their reports, you know. I will still help you with that. But you need to find out what's wrong with you. Welcome, IJ Okorie. Is your first time. Good evening, Ruth. Welcome. Okay, I just reconnected. You went down a bit. I'm sure we'll all join back again. Somebody is asking, Ajike Ade is asking, what are the possible reasons for general body pain? Inflammation. If you have some kind of inflammation, or you have some radicals in your system, you need to detoxify. It's good for you to detoxify, and it could be your posture and the rest. I've already talked about that. So it could be any. So prevention, like I said, is better than cure. Fumi Adisa. Yes, I just lost my dad. She said I'm a strong woman. I just lost my dad. But thank God she's with Jesus. My dad got born again before he died, which was my prayer for him since I was 12 years old. I got born again when I was 12 years old, and I've always prayed for my father to get born again, to know Jesus. And within the last 2 years of his life, I thank God he gave his life to Jesus. He even went about evangelizing, and he saw heaven. My father saw heaven, and he wanted to be in heaven. And even when he was ill, we were telling him, Dad, stay more. He said, no, he wants to go there. So yeah, it's paining me. I wept because I'm missing him. But I know he's with the Lord. And someday I will meet him. Thank you, Fumi. Thank you very much for the condolences. All right. What is the best sleeping posture? Somebody is asking, or Motayo is asking, what is the best sleeping posture? It depends on you. Make sure you're comfortable. Make sure your neck is not hung anyhow, or your leg. Just be comfortable. Make sure you have good bed. Make sure you have good pillow. Make sure your sleeping environment is good. Then you will sleep well. Thank you. Thank you for thanking me, Abimbola. Thank you. Thanks for all the love and all the hearts. I'm very, very grateful to every one of us. We are all welcome. I think I've taken all the questions. I don't think there's any other questions that is remaining for me. Yes. Thank you for all the condolences. Thank you. When we just laid him to rest. We're still going to do the funeral, ceremony. I will invite all of you there so that you can come to my village. Nnewi is my village. We come and go and thank God for a life well spent. So I'm not sad. I'm at peace that my father is with the Lord. And my prayer for you and for me is that we meet Jesus, because when we finish our work here, we need to go. Nobody will remain here on earth. We need to go. So let it be that we go over to Jesus and not to hell. DM me and I'll tell you how to do that. How to make sure you're with the Lord Jesus. Accept him as your Lord and personal Savior. All right. Imobonvi says this is her first time and it's interesting. She needs my help. She's having pain on the leg, on her waist, on her knee. Oh, wow. And then she says, how can she get omega-3 and the amount? Please, WhatsApp me, Imobong Vincent. Please WhatsApp me on my number on the screen, +234 703 515 1642. Forever Move. We make you move properly. All the pains we go. And again, I'm still doing discount. I forgot to say this. Like I told us, it's not all about the money. No. It's not all about the money. I want you to be well. I want you to use these things. I want you to be free. So I'm still going on 20% discount on all supplements that can help you stay healthy. 20% discount. So DM me and you will get it anywhere in Nigeria and anywhere in the world that I can access. If I can't access it, you will buy it at a normal price, but I will help you. But most places I can access. I'm using this week to make sure I get my company to give me access to give you 20% discount anywhere in the world. So DM me. You're going to be getting it. Thank you. Everybody is sending condolences now. Thank you. I can't mention all your names, but all those condolences. Oh yeah, Crusade Navy, nice one. Yes. Welcome all first timer. Thank you very much. Please place your orders so that you can get your 20% discount today, tomorrow, and day after tomorrow. I don't know if I'm going to continue that because I want to make some profits. I should make small profit now. I want to make small profit, so I'm just giving you this discount till Wednesday, please, so I can go back to my normal sales and make some profit. I need to make some profit. Thank you all for joining me. I love you all. Aging with Grace fans, thank you for all your condolences. Thank you for all your appreciation. Thank you for all your questions. It's because of the questions people asked me last week that made me to go over here, to talk about the cervical spondylosis today. Your questions will also help me to know what else to tell you on Monday concerning arthritis, okay? On Saturday, join me as we do some neck exercises. God bless you. Love you all. Bye for now. Bye.